Today we're talking about something a lot of moms go through, and sometimes unplanned and sometimes planned. But having a C-section comes with a lot of questions during your postpartum recovery. So today I'm going to talk through some of the tips and tools to help guide you into your healing process and help create more of this empowerment within you so you can heal yourself the best way and take care of your family. My name is Dr. Dawn Andalone. I'm a pelvic floor specialist, a women's health physical therapist that sees so many women during pregnancy and postpartum over the 20 years of my experience as a physical therapist. And after having 2 babies myself, I know that having a C-section should not be taken lightly. I think a lot of times women are expected to get back into their regular everyday life too quickly, but it is so important that you really process any kind of the psychology of it that you're going through, any emotional stress or feelings during this recovery stage is super important. So talking to other women who have also had a C-section and also finding a group, a support group with other moms around you during this postpartum time is also very helpful, and I found it helpful for myself. Now, going through a C-section, there may be a lot of questions that you don't get right away from your doctor or about movement, diet, those kind of things. So that comes into play, and seeing a pelvic floor physical therapist, they're going to be guiding you in the right direction when it comes to your recovery and healing. Now, during this postpartum time, not only going through addressing some of the emotional and feelings that you're having, but also taking care of your body to rest and recover, and rest being the number one tip that I want to give you today. And rest and recovery is important to plan for. And if you had an unplanned C-section or an emergency C-section, just know that if you do have anyone to reach out for help in the last minute, or being able to come over and help you take care of the baby is going to be very crucial and important, because this way you can't take care of someone else until you take care of yourself. So resting, recovering, and making sure that you're getting help is very important. Being stocked up on items, whether you're doing grocery delivery or sending people out to get things for you, can also be very helpful. I know when I was a new mom, I had other neighbors and friends reach out and try to drop off meals and things like that for help. So take the help. It is okay to ask for help. At this time, you want people to help you so you can fully rest and recover. It can be helpful too if you had a planned C-section to have already set up a little toolkit. So you have some water, supplies, diapers, things like that close by, so you don't have to navigate around your house, but you have everything you need right there. And it's also important to note that not only preparing yourself for rest and recovery, but knowing what your body may feel like, and the physical rest and recovery is going to look different from woman to woman. I can honestly say I've seen some women take a lot longer than 4 to 6 weeks, and some women months at a time until they start to feel better. That is not to scare you if you have not had a C-section yet, but some women start to feel even better after 2 weeks. So it just depends on the rest and recovery that you're getting and how you take care of your body. And also to just knowing every woman is going to heal differently depending on their body as well. And while you are resting, if you're resting in bed, a good idea is to lie on your side when you are sleeping or resting. Put a pillow between your knees. This can oftentimes feel the most comfortable and also the easiest to get in and out of bed. If you are sitting on a low couch, a low chair, or you're lying on your back with some pillows under your knees, that can be great too, but the hardest part is getting up, and so you're not straining your scar area and you're not causing extra pressure around your incision. So making sure that you're doing some breathing and exhale as you go to get up, but don't get up like a sit-up. Instead, roll to your side or get some help to get up. So roll to your side first out of bed and then sit up like a log roll. That can be creating less pressure and tension around that area, causing less pain and helping your body feel better. The next is move gently and safely. Now, walking is going to be important, but not any strenuous activity. You don't want to be doing hills. You don't want to be climbing stairs, especially in the first 2-3 weeks. You want to do just some movement, but not over movement. Movement is important to prevent blood clots and just allow for that circulation and blood flow through your body, and also to stimulate a bowel movement. You don't want to get constipated as well. So doing some walking and making sure you're not lifting or anything heavy or carrying your baby for long periods of time, but you do want to get up and move, and even do some gentle breathing exercises while you're in bed. I do have another video about diaphragmatic breathing and some deep breathing exercises that can be helpful for you, but I'll show you right here. So doing this in bed, you can be lying down and just place your hands wherever you're comfortable. Sometimes it's not very comfortable to touch that incision. That's okay. You can be up by your rib cage, but you just want to imagine that your belly is rising and falling, and breathing into your ribs and breathing into your belly is going to be a natural way just to get some movement through this area, through your core, and also allow for more blood flow and circulation to that area, and allow your nervous system to relax as well. So doing some deep breathing, you can breathe in through the nose and out through the mouth. And doing this and allowing this area to completely relax. You can even rock your knees a little bit side to side, because that way you are going to take some stress and tension off your hips and your lower back too. So you can practice that as many times a day as you want. Do about 10 deep breaths at a time. That's a good way to down-regulate your nervous system, so therefore you're not experiencing as much pain or anxiety about your recovery. So next tip is caring for your incision. You definitely want to keep it clean and dry. Listen to the instructions or read the instructions they gave you after you went home, because a lot of times that's going to be a blur. So you may have some instructions from your doctor how to care for the incision. It's important not to be rubbing lotions or getting it wet, and not irritating that area until you're fully clear that the incision has completely healed, and therefore if you are getting any signs of redness, puffiness, or increased pain or oozing out of that incision area, you definitely want to check back in with your doctor to make sure there's no signs of infection as well. Now, after clearance from your doctor, and when that incision is fully healed and you're cleared to go in a swimming pool or get that area wet, you can also do some scar tissue massage above the incision, or even later on around the incision as well. I do have a helpful video on this because it helps decrease that pain level, helps break up any scar tissue or adhesions, and will help those core muscles really get stronger when you start doing more exercise as well. So go back and watch that video I put in the description below about scar tissue massage and how to help that area heal. The next one is really paying attention to nourishing your body. Pay attention to high protein foods, high fiber foods to prevent constipation, and drinking a lot of helpful fluids like water or electrolytes, things that are going to flush out the system and allow, if you are breastfeeding, allow for your milk supply to continue to flourish. You don't want to add in more things like coffee or things that are going to dehydrate you. You definitely want to stay hydrated, and drinking a lot of water can definitely help you in that recovery phase as well. And next, and last but not least, be kind to yourself. Like I mentioned before, every woman is going to recover differently, and you can't compare your story to someone else's C-section recovery story. I hear a wide variety of stories after a C-section, and just know if you are really listening to your body, you're consulting with a healthcare professional that you trust, or even reaching out to a pelvic floor physical therapist. Even if your doctor hasn't referred you to one, you can go to one yourself. You are going to find a lot of healing and recovery and helpful tips in person as well, if you are following along and getting the guidance that you need. Now, these 5 tips are my first 5 tips after a C-section recovery. There is so much more in leading down the road to getting back into activity and fitness and what type of exercises to do. So keep watching this channel, subscribe if you haven't already, as I release more videos about postpartum recovery and helpful exercises that you can find if you're experiencing any unwanted symptoms. I can't wait to help guide you on your recovery journey. So best of luck to you and congratulations, and thank you so much for watching.